Addressing North Carolina's medical debt crisis, today it is estimated that 13% of adults have an unpaid medical bill of more than $250, putting North Carolina in the top 3 states with the highest share of medical debt. This afternoon, Governor Roy Cooper gave an update on steps being taken to tackle medical debt across the state. This summer, federal regulators approved his plan to incentivize hospitals with enhanced Medicaid payments. In exchange, they forgive portions of patients' debt. He says the program has the potential to relieve $4 billion in existing debt for upwards of 2 million lower-income patients. Since August, all 99 eligible North Carolina hospitals have agreed to participate.
And I'm just so excited for people who are finally getting this off their shoulders, because many of these people were very burdened by this.
Despite this effort to cut down debt, growing medical costs continue to impact thousands of families across the state. What can you tell us here?
Yeah, and to understand the toll it can take on a family, we sat down with a married couple living in Shelby, and last month the wife, Natasha, was diagnosed with cancer. Now, while her health is absolutely their first priority, the financial impact of her diagnosis is also top of mind.
My husband's been pushing me, go to the ER, go to the ER. So I finally went. And then that's where they told me, in the ER.
An ovarian cancer diagnosis, news the former registered nurse living in Shelby took surprisingly well.
I was tired, so I went to sleep. And then in the morning when I woke up, I was thinking, oh, this is a comfortable bed. And then I thought, damn, I have cancer. I kind of said, well, let's deal with it, you know?
Her husband, who's been dealing with health issues himself, is devastated.
We have been together. We've been crying together. Excuse me. We've been crying. We know what's going to be happening physically, mentally, financially.
Since her diagnosis, the Sheldons have had to make back and forth trips from Shelby to Charlotte for chemotherapy. While her chemo is currently being covered by insurance, her $1,000 co-payments for side effects to her liver are coming out of their pockets.
We go from paycheck to paycheck. This does not last.
With coverage uncertainty, the couple is now relying on their community for help. Natasha, like hundreds of others facing medical costs across North Carolina, has set up a GoFundMe.
It's very humbling that they would send what they did then, knowing all their situations as well.
The couple, who says they've always paid their medical bills, also plans on selling some of their belongings to prevent from falling behind. While they've been able to cover expenses just 1 month out from her diagnosis, they worry what could be on the horizon.
The insurance company, it would be good if they gave more, because they take. North Carolinians are, or even countrywide, we're suffering.
Now, on top of medical expenses, the couple strongly believe that insurance should also cover other costs like transportation to and from treatments. Now, it is important to note that Governor Cooper's plan to cut down statewide medical debt cancels out old bills. As of right now, it does not touch new medical costs. Alicia?